Alright dudes, I was gonna talk about the flu this video, but you know what's more fun than the flu? Going to the gynecologist!
That's so science.
Now going to the gynecologist may seem like a really scary thing, but it's really important for anybody with female reproductive organs to go and get an annual checkup. Now this annual checkup is called a well woman visit, but it's for anyone with female reproductive organs. Uterus, ovaries, and or vagina. In case you're scared, or maybe just curious, I'll walk you through a typical gynecology visit.
Most doctors' offices, the waiting room's a nice shade of puke green with some months-old magazines. Once back in the examination room, they will leave you to change. That means taking off your clothes and putting on a cute little hospital gown, which everyone looks so great in, especially me, don't you think? And just so you know, you won't be fully exposed during the exam. They give you a little sheet to put over your lap for privacy.
And just in case you're especially nervous, it is totally fine to have your mom, your sister, or a nurse stay in the room with you.
See? Here's a sign to prove it. And while you're waiting, they are kind enough to provide some light reading about babies, which I'm so not ready for. Or you can play with this thing. What does this do? Ooh, pull tab. Ooh, it's a baby belly.
When you first get there, the nurse practitioner or the gynecologist, whomever you see, will ask you a few questions about your sexual health history. Now these seem kind of invasive, but they're really important to gauge your risk of STDs. The actual exam itself doesn't take very long. It's short, sweet, and to the point. You can think of the exam in three parts: the external, the speculum, and the bimanual internal exam. Step 1. Doctor checks the outside of your lady area and makes sure everything looks okay. Step 2. This one's going to seem a little scary. This is when the doctor will use a speculum to insert into the vagina to get a better view, and this is when the pap smear will happen. Pap smear is done by using a long cotton swab, about this big. It's really similar to what you put in your ear, just a little bit bigger. And the doctor will swab the inside of your vagina and your cervix to make sure there's not any abnormalities on your cells. It's not painful, but it might be a little bit uncomfortable, but it will last 5 seconds, 10 seconds tops. The importance of this test is to look for signs of cancer or anything that might lead to cancer. Part 3. This is called the bimanual. And bi meaning two, manual meaning fingers. The doctor will insert 2 fingers into your vagina and place the other hand on your belly and feel around in your ovaries and your uterus to make sure everything is okay. Your doctor may also examine your breasts, and this is when you'll have one arm or both arms over your head, and the doctor will manually check your breast to make sure there's no abnormal lumps, bumps, anything weird. This is also a very important test you can do on your own when you're in the shower, getting ready for bed. My advice, get a mirror, check down there, get to know your lady parts. Just make sure you know yourself, so that way if anything's out of the ordinary, you can call your doctor right away. That's it for me. Leave any questions, comments below. I want to know what you guys want to hear about next.
Don't forget to hit that like and subscribe button for more That's So Science.